COVID-19 is affecting everyone, and it is important that we practice self-isolation for individuals that are returning from travel outside of the country. Whether you are an international traveler returning by plane, or a snowbird driving yourself home for the season. Self-isolation begins the moment you arrive in Canada. In order to reduce potential exposure to the community, return directly to your home and avoid all contact with the public, including family and friends. Do not stop for essentials such as groceries or prescriptions, as these can be delivered to your home. So why is self-isolation important? There is activity and transmission of COVID-19 outside of Canada that is being imported in. People coming back may have the virus and not realize it, only to develop symptoms later on. They may be infectious before they realize they have symptoms, and this can start a small spark or outbreak. This can not only pose risks to vulnerable populations such as older adults and individuals with medical conditions, but can also overburden our healthcare system. Together, we must do our best to flatten the curve. So what must I do as a returning traveler? The most important is to stay at home. Maintain self-isolation for 14 days. Symptoms can take up to 14 days to manifest, but during this time, individuals can still be contagious and infect others. This means do not go to work, school, or other public places. Do not use public transportation, taxis, or rideshares. Rely on friends, family, or delivery services for groceries, prescriptions, and other supplies. Make sure to have them left outside your door to prevent contact. Try and reschedule all non-essential healthcare appointments and only visit healthcare providers after calling before to allow them to make necessary precautions. Make alternative arrangements for children or vulnerable family members. Try to sleep in a separate room. Try to limit time in shared spaces. Using a separate washroom and minimizing time in kitchens and living rooms can be a good place to start. If you have to be in the same space as others, wear a mask that covers your mouth and nose. Know what to do if you develop symptoms. If you develop mild to moderate symptoms such as a cough or fever, call your healthcare provider for advice or visit the community COVID-19 assessment center. If you experience difficulty breathing or any other severe symptoms, call 911 immediately and inform them of your recent travel history. Lastly, look after your mental well-being. Stay in touch with friends and family through phone calls and video chats. You can use this time to learn a new hobby, unplug, practice mindfulness, read, exercise, or just catch up on your favorite show. Remember, by staying home, you are doing what you can to keep your loved ones and your community safe. Thank you so much for watching, and for more information, please visit kflaph.ca or the Public Health Agency of Canada website.